welcome back to my channel. I'm Taste, and if this is your first time coming across my channel, you are welcome. Please subscribe and turn on your notification button. Yes, on this video I'm going to be talking about therapies. Yes, the different kinds of intervention that are available that you can choose which is best suited to meet the needs of your child. Please stay tuned and let's dive into it. Choosing the type of professional to evaluate your child is only part of your task. You also want to keep in mind what kind of treatment your child might need based on the expert's recommendation. Remember that the expert you choose may probably have a direct effect on the type of treatment that is recommended. Without wasting much time, let's dive into the different type of therapies that we have. Let's go. I'm going to start with play therapy. Yes, I know it may sound fooling around. Play therapy is the most common type of psychosocial therapy often used for preschool and elementary age students. Children often find emotions confusing and difficult to express. But through play, children often clearly reveal how they feel and think. Because play is a child's natural form of communication, even the most talkative children usually express themselves fully through their play. Most good psychotherapists are often trained to use play to help children to cope with uncomfortable emotions and find solutions to their problems. This may take a form of variety of treatment methods, all of which make use of one or more natural benefits of play. During play therapy, your child will work with a play therapist who guides the play session to help the child resolve problems. Different play therapists may use different play methods. Some may work directly with a child's problem, while others use play to gain insight to the child's personality and perception. Because it is important for your child to feel safe during play therapy, most play therapists will keep confidential about what the child actually say specifically or does during the play therapy. But they can share general information and progress with you. This can help your child to fully express his or herself without worrying about your reactions. Now, let's talk about the benefits of play therapy. One of the major benefits of play therapy is developing coping strategies and creative problem-solving skills. Taking more responsibility for certain behaviors, self-respect, empathy, and respect for others, alleviating anxiety, learning to fully experience and express feelings, building stronger social skills with peers, and building stronger family relationships. Play therapy can encourage the use of language and can also help to improve gross and fine motor skills. Now, let's take a look at when it is necessary to recommend play therapy for children. Although people of all ages can benefit from play therapy is typically used for children between the ages of 3 and 12 years. Play therapy may be helpful in a variety of circumstances, such as facing a medical procedure, developmental delay or learning disability, problem behaviors in school, family issues like divorce, separation, or death of a close family member, domestic violence or neglect, anxiety, depression, or grief, eating or toileting disorders, attention deficit hyperactivity disorder, and autism spectrum disorders. So, what is play therapy? Play therapy is a form of therapy that is used for children between the ages of 3 and 12 years. That's because children may not be able to process their own emotions or articulate problems to their parents or other adults. While it looks like an ordinary playtime, play therapy can be a lot more than that. I know you have some questions in your mind like this play therapy, how does it work? Now, let me tell you, there's a bit of communication gap between children and adults. Depending on the age and stage of development, children simply don't have the language skills of adults. They may feel something, but in most cases, they either can't express it to adults or they don't have a trusted adult to express it to. On the other hand, adults can misinterpret what the child is trying to say or completely miss the verbal and non-verbal cues of the child. Children learn to understand the world and their place in it through play. It is where they are free to act out their inner feelings and emotions. Toys can act as symbols and take on greater meanings if you know what to look for. Since children can't express themselves fully in the adult world, the therapist joins the children in their own world at their level. As they play, the child may become less guarded and more willing to share their feelings, or they are not pressured. They are allowed to do so in their own pace and time and with their own method of communication. Play therapy sessions can take place in an environment where the child feels safe and where there are few limitations. The therapist may use techniques which includes creative visualization, storytelling, role playing, toy phones, dolls, action figures, art and craft, water and sand play, blocks and construction toys, dance and creative movements, and musical play. There are a lot of things you can actually include in any play therapy session, depending on what you're looking out for or your target during that session. If you find this video helpful, please give it a like, comment, and share. Please share. Oh, don't just look and pass. Share to your friends, share to your family members, share to your groups, send it to your WhatsApp groups. Let them also see and learn, because there are so many things we take for granted. Things that normally we say, it's not play. Play is not just play. For some children, play is a therapy, a method of therapy used for children who actually needs it to develop like your own children. So do not take play for granted. And if you see your child playing so creatively, don't be so quick to stop that child from playing. Yeah, because you don't know that child is actually that child is developing their creative minds, the ability to solve problems. Do not be quick to chase children around from playing. Yes, there's this play we used to do. We cook with sand. What were we doing? Were we actually cooking normal food? No, we were practicing how to cook, the process of cooking, how to be careful while cooking, these are things you learn through play. It's not everything that parents will carry, okay, come and learn this in the kitchen. No, some of those skills are picked up from playing while they are trying to visualize, oh, how they saw mommy cooking in the kitchen. They try to now put it into practice with sand. Allow your children to play. Don't lock them up inside. Play is essential. Play is part of children's development. They need to play. They need to climb. They need to fall and adapt. When they are falling next time, they are more careful on things to play on that will make them fall to hurt themselves. Allow your children to engage in adventurous but safe play techniques. Allow your children to play. If a child is always jumping from one chair to, don't be so quick to say, oh yeah, you will spoil my couch. When that child falls the first time, you don't need to tell the child, don't jump on my table. The child will automatically learn through experience. Please allow your children to play. See you in my next video. Bye for now.